Hello, everybody. Welcome back to Page in America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. Dr. Davidson, are you still coming to us from the other side of planet Earth?
I am. I'm coming to you from tomorrow again. So I think we're recording here. It's Friday morning here. I think we're in Thursday and the rest in the USA.
Okay, wow.
But yeah.
No, it's not the morning. It's the middle of Thursday right now here.
Yeah. Let me tell people, the Kiwi sun is real, man. I remember when we came here, a decade and a half ago, everyone was talking about ozone, like the quaint days when we worried about the ozone, and that was the thing that kept us up at night, right? And it's I didn't really plan as well as I should have for sunscreen. So 54 years on this earth, haven't figured that out yet.
I don't know if the listeners know this about us, but we are both, at least partially, of Italian heritage, and you're looking the part today.
Yeah. That's good.
Yeah.
Back to my ancestors. Yep. Yeah, how you doing today? I know you've been a little bit sick. How you doing? You on the mend?
I'm pretty good. I know. Since I had my first outing last week and getting on airplanes and going through the airport since having the kid, and I was like, you spend like a month or 2 months like taking care of an infant, and then you get back out in the world, and the airport was stimulated. I was look at
too much.
I was
really
stimulated. No, not too. No, it was great. But I was just like, It was fun to be back out in the world. But it was just like, so it kind of reminded me of after you stayed in the box for months during COVID. I know that a lot of physicians didn't have that experience, but for those of us who were, just being amateur epidemiologists in our living rooms, when we left the house for the first time, it was like, oh, there's a lot going on.
Yeah. So much input. Yeah.
Good.
Well, I'm glad you're on the mend. Yeah. Welcome back to the world.
Yeah. All right. So we got a huge show today. We're going to structure it a little bit differently than we do for folks listening. At the beginning, we're gonna cover ICE. And we're going to talk about the goings on in Minneapolis. And then what we are going to do is we're going to kind of take a tour of the Midwest, and we're going to check in with some physicians in Ohio and Wisconsin about ICE activity in their states, respectively. And then we're going to go on and finish the rest of the show for those of you who are here for healthcare policy or the goings on with Robert Kennedy or the various news items. Those are going to be in the back half, but it's going to be sort of all ICE all the time at the beginning, and we'll take the tour, and then we'll come back to regularly scheduled programming. So why don't we get right into it, Rob?
For sure.
Okay, so for some background material, the murder of an ICU nurse in Minneapolis by U.S. Customs and Border Protection agents is now last Saturday. 2 U.S. Customs and Border Protection agents shot a peaceful protester, Alex Pretti, in Minneapolis. Alex was a registered nurse who worked in the ICU at the VA hospital. This has been, the thing that really came home for me about the murder of Alex was an ICU. They try to demonize everyone that's been hurt by ICE. They call it, whether they dismiss them as immigrants or whether they dismiss people as terrorists or domestic terrorists, or they try to other everyone. It's really hard to other an ICU nurse because of the type of person it takes to do that job and do that at the VA. And it struck me that is part and parcel why so many people were able to look at this and see it for what it was and look past the government propaganda that was coming out. I'm wondering if Rob, if you could speak to that role, or your thoughts on it, but then also would love to have a discussion on the nature of being an ICU nurse. Yeah.
Yeah, I mean, I can speak more to nurses in general, and certainly in the ED, and there's a lot of personality similarities between ED and ICU nurses, and a lot of them, at least in our institution and others I've worked at, go between both, right? There's because you're dealing with critical patients, you're having to make decisions fairly quickly in certain times, and I remember what I saw both in the ICU. I worked in the ICU during COVID. They needed people to cover shifts, so we did some ICU shifts, and then of course in the ED, and like these are people who run into rooms, right? I remember Trump and his bullshit. How beautiful it was seeing people run into COVID, like soldiers running into bullets. Like, well, A, soldiers don't run into bullets; they try to avoid them. B, Yeah, nurses are the front line of doing that, right? Someone's sick, come through the door in the ED, they run out, grab them, hoist them up onto the beds, throw them on oxygen, hopefully have their mask on. I saw this all the time. I mean, these are, for the most part, like selfless people, don't get paid nearly enough, work too many hours, probably in most cases have too many patients that they can care for, but they still do it. And the fact that this guy was doing this at the VA, right, caring for a group of
Yeah.
people who deserve every bit of attention we can give them as our fellow Americans, and who have been screwed by, by this VA in this administration with staff cuts and all that. I mean, yeah, I think that has a lot to do with the way the narrative is shaping around the country. And it's sort of like, I mean, you said ICE up front, all the time. I mean, it's kind of all that I've seen come across any feeds from any perspective you can imagine. I mean, the gruesome nature of the videos. I mean, the obvious nature of the videos, that this is a peaceful person trying to protect, like in his role, out there on the street, he was trying to protect another person again, kind of like this he probably did throughout his career. And yeah, I think it's a special breed, and it's horribly sad. Very dark days.
Yeah.
Hopefully something can come of this to change the situation,
Yeah.
that's going on in Minneapolis and everywhere else.
Yeah. It was it struck me that it's part of his profession that shattered the government narrative right out of the gate. And so, you saw the video, and then the government said he was a domestic terrorist, and that he was there to kill law enforcement. Then you get the second perspective, and then you find out that he's an ICU nurse, and they realize that's not gonna hold water. And so
Right.
then they come out and say, well, they had to shoot him because he had a gun. And then you have the NRA come, a legal gun that he did not brandish or pull out. And then you have the NRA come out and say, no, hey, you can't say that, Republicans. And so they had to walk back. And now their new line is that he was protesting aggressively some like 10 days prior, which of course just to discredit him, but of course the punishment for protesting is not capital punishment. And so they're just kind of like searching around on the floor for anything to stop the bleeding of public opinion. But I don't think it's going to stop. And two, it just all comes back for me that the nature of his profession. We don't get to know a lot about Alex, right? We're learning more things, but at the very beginning, we didn't know much about this man except for his profession, but that it's such a noble profession that, and it's such a respected profession in the way that he did it, that it took the government to task, and it broke their lives kind of in half. And so, and we're in the consequences of that. So
We are. Yeah. Well put. I think we ought to do our part to try to turn back what has been going on here for way too long.
Yeah. So just a little bit of the fallout of all of this. Greg Bovino, who was the commander at large, who we had to suffer under the field marshaldom in Chicago for several months. I like to call him SS Polly Pocket because he's a little guy. If you haven't seen if you haven't seen a picture of him, but SS Polly Pocket has been exited from Minneapolis. He's been sent to California, where he's expected to retire. They've brought in border czar Tom Homan to replace Bovino, who's trying to cool things down. Tom Homan, prior to Greg Bovino, was considered a stone cold radical, and now he's the face of reasonableness in terms of the government. And they sort of represented the different factions inside of immigration enforcement, one being a very far right, very hardline immigration enforcement that was within the confines of professional policing. And then the other one, which was this new thing that they were doing, which was just like siege on a city. So it looks like we're back to just regular radicalism under the the leadership of Tom Homan. Minnesota Governor Tim Walz has activated 1,500 National Guard members. They're wearing reflective yellow vests to help distinguish from the other federal agencies that are largely hard to tell apart and hard to identify. And they have been seen distributing coffee and donuts to protesters in order to keep the peace. In response to the murder, congressional Democrats are threatening to withhold votes on a package of bills to fund the government, includes increased funding for DHS. Senate Democrats will not provide the votes to proceed in the appropriations bill if the DHS funding bill is included. That's from Senate Minority Leader Chuck Schumer. The Democrats are, I will say this, the Democrats have been slow on the ICE stuff, and they've been doing the Democratic Party thing where they like worry about the words that they're using, that they're still scared from the defund the police days, where no Democrats but some activists did overstate, and maybe had sort of a non-persuasive message. But it strikes me that this ICE stuff is just totally a different ballgame. That people are smart enough to tell the difference. And then secondly, although they were slow, it does look like now this is now in stark relief for the Senate Democrats, and people are holding the line, hopefully they'll continue to do so. What are your thoughts on that, Rob?
Yeah, I mean, one, for Democratic leadership and Democratic elected officials, when Tom Homan becomes the voice of reason, it's time for you to fucking say something, to do something, right? Now we can all say something, right? We can all call on people to do things. They have the actual power to like hold up these bills. Yeah, shut down the fucking government and whatever that is, whether it's defund or reappropriate or guardrails or guide, like lots of things, right? So much has gone wrong.
Who cares? It's like don't quibble about the words. Make the moral argument. There's moral clarity in being against this. You don't have to in the round argue about the policy particulars to rein in this chaotic, violent agency. Just say you're going to rein in a chaotic, violent agency.
Yeah, I saw a statistic the other day, and I don't know the exact numbers, but so when Obama was president, right, like the number of people deported was significantly higher than Trump, and the number of American citizens murdered was 0, right? And I think we're on 2 in the last month. We're 5, maybe somewhere in that handful. Like, Jesus Christ, like they can do this job, as reprehensible as parts of it we may think. However your views are on that, they can do this thing without, like you said, laying siege to a city, without going door to door, ripping people, without taking 5-year-olds and putting them in jail to lure their parents in, right? Without going to churches, without going into hospitals, all of that.
Without going into hospitals.
Dems need to fucking stand up.
Yep. All right. So I'm going to save our extra criticism for organized medicine. We got a statement out of the American Medical Association. They issued a tepid statement saying that it is deeply concerned about ICE in hospitals and emergency rooms. I'm going to read the whole thing. The American Medical Association is deeply concerned by reports of immigration enforcement activity in and around hospitals and emergency rooms, a tactic fueling fear among patients and hospital staff alike. When people are afraid to seek medical attention for themselves or their families, it threatens their health, impedes the ability of physicians to render care, and ultimately undermines basic trust in our healthcare institutions. To fulfill our oath and best serve our patients, physicians must be able to work in spaces that create a sense of safety for all, not fear for our most vulnerable. All of that is both reasonable and the bare fucking minimum. It's not calling for congressional action. It's not putting an ultimatum, and we're not going to give you any money. Like we're not going to give you PAC money if you don't do something about it. It is just this like bare minimum PR, like PR meat grinder statement where like six communications majors from Vassar had to all sit around the table and hammer at this thing and make sure every word was inoffensive, and then they got it out the door. And so I think you're seeing another instance of someone being slow to arrive at moral clarity. What are your thoughts on the AMA's statement, Rob?
Well, when I see it first, I think they want to become now the Susan Collins of of medical, physician advocacy, apparently, right? Deeply concerned is her tagline. So I don't know if she has a trademark. I wonder if she got a little kickback on that in their statement. The other is what you said, right? Like have this come with some, some actual calls to action, like do this, do that, not just seems like a bad thing. Yeah, no shit. But then let's see, right, in the next month, 2 months, 3 months, next election cycle, how many of these Republicans who are supporting this shit they give money to. Right. We've seen that, right? We had parts of the team, the Committee to Protect Healthcare have done some of the research. And after they came out saying they didn't like the Medicaid cuts in the big, beautiful bill, they donated max pack checks to multiple people who voted for the big, beautiful bill that cut $1 trillion from Medicaid, right? After they said thought RFK Jr. was not a great idea for HHS, they gave money to people who supported RFK Jr. for HHS secretary. So let's see now what comes out of this, right? Are they going to withhold those checks from those people that support what ICE is doing? Remains to be seen, doubtful.
Yeah. But that's right. AMA, put your money where your mouth is. Stop handing out checks to people who put soldiers in hospitals. God damn it. Okay. I would just like to note, Dr. Rob, that the Committee to Protect Healthcare has a new petition that it will be delivering to Congress that calls for the banning of armed agents of the state from DHS, both ICE and Border Patrol, from going on hospital grounds across the country. We are calling for that unequivocally. We encourage the AMA to call for that unequivocally. And we encourage any physicians or nurses who listen to this podcast to please find in the show notes that petition and please add your name. Anyone who adds their name, it's really helpful. We want to show that there's depth and breadth of support from clinicians, not just physicians, but doctors and nurses, PAs, you name it. You're able to sign on, and we'll be delivering that to Congress. So that's just a next step for anyone who's fired up for about the AMA's tepid statements. So, yep.
All right.
Before we move on for ICE, we normally put our guests at the back half of the episode. But what we're going to do right now is we have Dr. Chris Ford from Milwaukee and Dr. Anita Somani, who is also a state representative from Columbus, Ohio, are both going to come on, and they are going to share their perspectives from other states outside of Minnesota. And that's because we are laser focused on Minnesota. They're killing people in Minnesota. That is why we should be laser focused on it. But ICE is causing problems in cities across the Midwest. So we're going to check in with friends in Milwaukee and Columbus, Ohio, and then we're going to come back and finish up the show. So why don't we throw to that now? All right, everyone, welcome back. Today we are joined by Dr. Chris Ford. He is a practicing ER doctor in the city of Milwaukee, Wisconsin, and he is a board member of the Committee to Protect Healthcare. Dr. Chris Ford, thanks so much for joining us on Paging America. How are you doing today?
Oh, man, we're trying to stay warm, Miles. It's always a pleasure, though, my brother.
Yeah, I know. Every conversation we have in the Midwest is like it leads with ice and snow for sure.
I'm telling you.
All right. Well, thank you so much for sharing your perspective with us today. We're checking in with physicians across the Midwest around. We've had a lot of focus, rightly so, on Minneapolis, but there is weird and strange and spooky DHS and ICE activity in cities across the Midwest, and we're kind of taking a temperature check on what's happening in other places. So, Milwaukee, the Milwaukee Metro. I haven't heard news out of the Milwaukee Metro yet, and I'm wondering if you could share with our listeners your perspective on what's happening.
Yeah, so for the last month or so, there have been these rumors circulating around, right, about ICE has, they have commandeered 200 rooms at a certain hotel, et cetera, et cetera. And so some of those allegations have been proven to be false. However, it seems as though, a lot of the hospital systems in Milwaukee as well as throughout Wisconsin are starting to take it more seriously because, in talking to, folks that I work with in the emergency preparedness realm, as well as, folks that work at other hospital systems throughout the state. Hospitals are getting ready. We are preparing for the worst. We are all, wet blankets and Debbie Downers in emergency medicine, so we plan for the worst first.
Yep.
So we're getting stuff together for, what happens if an ICE agent presents to the hospital, right? What happens, to those routes for emergency, access for ambulances, right? And so, in a city that is the size of Milwaukee, which is not quite the size of a Minneapolis or Chicago, just a fraction of that presence is going to make some real waves in what we do in terms of our emergency preparedness and our availability for emergency departments throughout the state. So it's go time, and we're getting ready.
That's great. Yeah. So we had actually talked to doctors in Minneapolis, and we had heard that the level of change that they needed once, and obviously the ICE presence in Minneapolis is extraordinary, but the level of change in terms of their protocols and the amount of preparedness that they needed inside of their emergency departments and other hospital and other systems in the hospital was something similar to COVID, that it was like almost that disruptive and that in the change. I'm wondering, what in your mind, what are some of the more interesting or extreme things that people are having to do to get ready for in the event that ICE descends on the city in mass?
Yeah, so it's interesting that you bring up COVID, because a lot of what we are expecting to see and what we've seen in other states is very similar to that early portion of COVID, where people don't come into the emergency department initially, and a lot of that has to do with the fear, that human impact of what's going on, right? So during COVID, I saw patients that waited until they were near death because they were afraid to come in, right? No
Yeah.
society should accept that as being normal, but that was the reality of what's going on, and we see city after city, when immigration enforcement is visibly present in those communities, people are going to begin to avoid essential services, and that includes healthcare, right? And not only emergency care, we're talking about, barriers to people who are on dialysis, get dialysis 3 days a week, right? Those folks are staying home, right? And that becomes a barrier to care. That becomes a real tangible, tangible life risk that you have in those situations. And so, public health depends on trust, and, a lot of families are seeking help, and they're afraid to seek that help when they need it.
That's really troubling. Of course that's true. And also, like when they do this, it seems like no one voted for this. No one, even the people who are really interested in exiting immigrants from the country. I'm not sure a lot of the Republican supporters of Donald Trump and Miller were interested in cutting off access to health care for people, especially the ones who needed it. I'm wondering, you are also plugged into conversations with policymakers and other leaders in the city, not just leaders in healthcare, but leaders in the public policy realm. I'm wondering what at the policy level or at the sort of political leadership level, have we heard much in terms of a response or getting prepared in the same way that the hospital systems have to get prepared? Are people getting ready in the event that you have a larger presence of ICE in the city of Milwaukee?
Exactly that point. When I say, hospitals are getting ready, that means all of the systems are getting ready, right? So you not only have EMS systems that are getting ready, hospitals getting ready, local businesses are getting ready, a lot of groups that are stakeholders in the communities too, right? For instance, I was speaking to a leader of one of those organizations and a couple of, representatives of the area, and they were talking about their plans, right, that they have to put in place to consider those folks with dialysis, right, to consider those folks if they, are having heart attacks or having, et cetera, right, because a lot of people are worried about the risk of family separation if they present to those emergency departments. So they're working on how to get those individuals to, their appointments. Do they escort them, right? They're giving them access to legal representation, to documents. What are your rights in these situations, right? And so these are tangible, methods that people are kicking into action, and it takes that work. But fortunately, I think the entire community is working in that respect. And like you said, a lot of people didn't vote for this, right? If we look at on a national front, the approval rating, not only of this administration, is in the 30s, but also this administration's approach to immigration regulation, right? That is 38%, right?
Yep.
And so, that this has nothing to do with where you sit in the aisle, right? If you sit on the left, you sit on the right, if you're independent. This has to do with our communities and the real threats to public health that we have right now.
Yeah. It's going to be interesting to see if that number dips below 38, just to
Hmm.
talk politics instead of healthcare for a second. Like
Hmm.
some people speculate that sort of the mega the mega floor is around 36 to 38, and you might not be able to go closer to that because those folks are actually they're in it for the mean-spiritedness.
Hmm.
Hopefully that's not the case, though. I think what maybe people hopefully people see that in theory they can get on board with that, but once you see the images and once you understand the full ramifications, not just the
Hmm.
deporting people, but what it could do to healthcare systems, including
Hmm.
healthcare systems that you might need access to,
Who knew?
that it brings, that it brings it home for folks. One of the things that I haven't heard many people talk about is there are plenty of people who work in health systems who are sort of first generation immigrants or second generation immigrants who are
Hmm.
attached to immigrant communities. And because immigrant communities who have to either stay home or are sort of living in fear, you could see people who have key roles or key jobs in health systems having to become caretakers or become
Hmm.
helpers to their family members. I'm wondering if you've seen any of that either in the health systems themselves or in the economy more broadly.
Yeah, there's a lot of discussion right now as to what to do to those people that they can't get to the hospitals, right? And so
Yeah.
a lot of it has been kind of buzzing online. Groups are getting together, coordinating to see, can I provide some at-home care for these individuals in the community if I'm an MP, if I'm an MD, right? Or even a nephrologist, et cetera, right? And so, this is all in the purview that hospitals are supposed to be safe spaces, right?
Yeah.
And
That's right.
when they're perceived as unsafe, then the foundation for medical care collapses. And so healthcare workers are being placed in these impossible positions to try to provide care with their patients for fear of law enforcement presence, right? And so this is the eroding of the patient-doctor relationship that we're seeing in front of us, and we're trying to do all that we can in order to get out to the community and say, hey, this is a moral issue. This is more than just a systems issue, and we need to meet them where they are in order to make sure that in this time that is uncertain, that we don't end up having some people to slip between the cracks.
Okay. Last thing, Dr. Ford. So speaking of moral issues, we have the American Medical Association weighing in on what's happening with health systems. The American Medical Association put out a statement that I would describe as very tepid, maybe cowardly, but they said the American Medical Association is deeply concerned by the reports of immigration enforcement activity in and around hospitals and emergency rooms. And I'll summarize the rest. It went on to, it didn't call for action in Congress. It certainly didn't call for abolishing ICE, but it didn't call for any like legislative action that's specific. I'm wondering what you make of like, what needs to happen and what does the organized medical establishment need to do right now? Like, what's the level of the problem, and is it their responsibility to do anything about it, or is that outside their lane?
I could spend another hour here, Miles, talking to you about the AMA stances on
Sure.
things and what I think, but I won't spare you. I'll spare you that. So what
Sure.
I will say is that healthcare is important to everyone in our community. Emergency medical response is important to all of our communities as well. And when we have this fear of enforcement delaying care, we're seeing increased risk to lives in all of our communities, right? And so I am very much, in the camp of there is not much more that is important than this, right? Policies that deter people from seeking medical care harm everyone. There's a reason why the prior administration came out and did their memo to everyone saying these should be safe spaces, right? These, schools should be avoided. We should avoid places of worship. We should avoid hospitals. This doesn't just affect immigrant communities. This affects everyone, right? And it would behoove, the American Medical Association or whomever not to get involved and not to put all of their resources towards the front and say, we need to address this because, again, there isn't much more that's going to affect public health than what's going on right now. Time to get in the game, man.
Yeah. I think that's a great place to end it. I think that I couldn't agree more with you. So Dr. Chris Ford with the perspective from Wisconsin and Milwaukee, thank you so much for joining us.
All right, my brother. Take it easy, man.
All right, everyone, welcome back. Today we are joined by Dr. Anita Somani, who is she is a practicing OB-GYN in the Columbus, Ohio area, and she is also a state representative from Columbus, Ohio. Dr. Anita Somani, thank you so much for joining us at Page in America.
Yeah, thank you for asking me. Appreciate it.
We were really excited to have you come and share some of your perspectives on what's happening with ICE as it intersects with the healthcare system, because you have one foot in the world of practicing medicine and another foot in the creation of public policy, and that's a incredibly unique perspective for us, and also are in Ohio. So what we're doing today is we're checking in with folks around the Midwest on not just what's happening in Minneapolis, but how is current events playing out in their states. And so I wondered if we could start off with just talking a little bit about how is ICE and DHS immigration enforcement affected the state of Ohio from your perspective?
Yeah. So I don't know if you're aware, but Columbus has the second highest Somalian population in the country, second to Minneapolis. And so we have definitely been impacted. We have two Somali state representatives who are in the trenches there trying to help their community. What I know about Columbus is that we also are doing a lot of the organizing on the ground and fighting ICE in different ways, making sure that people are recording, filming, identifying when they see ICE, where ICE is. But from a healthcare perspective, it's impacted our patients because I'm in a teaching hospital, and the residents are seeing more no-shows. People are just afraid to come to the hospital. They'll be booked for an appointment, and then the nurses will follow up and they'll say, well, I just can't come in right now. I'm afraid to leave my house. I mean, they're not specifically saying ICE, but when you think about that from a perspective of delayed prenatal care or delayed care for a surgical problem, I mean, it's just horrible to think what we're doing, not only to people's mental health, but to their physical health when they're afraid to come to the hospital. The hospital is supposed to be a protected space, and I know the AMA is trying to work on continuing to make that a protected space so that ICE doesn't come here and take patients away.
Yeah. Actually, it would be really interesting if you could weigh in on the AMAs. It sounds like maybe you have some background information from the statement they put out. They said the American Medical Association is deeply concerned by reports of immigration enforcement activity in and around hospitals and emergency rooms. We read the statement earlier in the podcast. But it doesn't call for anything specific, at least in their public communications. I would say, like, we thought it was a little tepid, more than weak, sort of pathetic. I'm wondering what your thoughts are on that.
Yeah, I think we need to speak up more strongly. I think it's a statement that maybe will help hospital administration to get behind doing something.
Sure.
Yesterday there was ICE reported in there's an area downtown Columbus that has one of the freestanding urgent care centers, and there were reports of ICE right outside there. So again, they are targeting hospitals or urgent care or clinics that are in areas where a large immigrant population lives. So I don't think that's enough. I think, as everybody knows, silence is complicit, and we really need to be speaking out, not just as physicians, but as human beings. And, we're seeing all the things that have come back to haunt us from World War II and from the German regime of, first they came for these people and then they came for these people, and nobody spoke out,
Yeah. I couldn't relate. I just sort of like, it's very concerning. It's pretty easy to call sending soldiers to an urgent care evil. And it's like, there's not moral clarity from our organized organized medical establishment feels like it could rule the day if they could find a way to get there.
Right. Well, and again, none of this is making us safer. It's not making us safer because people are now afraid to call police. People are afraid to even, go see a doctor, or go to school, or go to the store. we're doing the same thing that they're doing in Minnesota. I have friends who belong to a progressive group that organized food, just, hey, drop off, we need these supplies, we need these things, and are
Yeah.
packaging things up to send to people. So and I mean, not only were two white people killed, but they've killed, what, four other people of color prior to this, before the uproar actually became such a big uproar.
Yeah.
So it's multiple people. It's not just one or two. And most of them are citizens. Most of them are trying to make America better in the sense that they are part of the community, which is why I think Minnesota has responded so
Right.
amazingly well.
Yeah. And, well, here in Chicago, they shot an immigrant who was trying to get away, and they lied just like they did in Minnesota.
Yeah,
They lied that it was like an
criminal.
attack on the officer, but he was fine, and they
Yeah.
exaggerated what had happened once the Chicago press dug in. I I always go to a place, Dr. Somani, of like uh the penalty for not complying with civil immigration reform isn't the death penalty too. And so we're thinking about like even if they are non-citizens, like that's still, you
Yes.
don't get the death penalty for not complying with civil immigration
Yes.
reform. I I wonder in for just the perspective on Columbus, how much what are some of the nature of the conversations with other medical practitioners in the Columbus area? Are people, what we heard from some doctors in Minnesota who came on and talked to us is that they described the response as, and Minnesota's maybe a different scale than what's happening in
Right.
Columbus, but they described the response and the readiness needed at hospitals as proportionally similar to the changes that were needed during COVID. That the almost the whole hospital, the administration of healthcare had to be dramatically changed, particularly in the emergency departments, because of the risk of ICE. And I'm wondering,
Wow.
I think that's probably a little further along, but I'm wondering
Yeah.
what the conversation is like in Ohio.
Yeah. I think there's two extremes. There are people who are burying their head in the sand, who are just like, no, this isn't happening here. And then there is the, let's prepare, let's be prepared. Let's make sure that, we don't let people in to the emergency rooms that don't belong there. You have to have a
Oh,
reason to
wow.
come in.
Yeah.
And, um, and it's sad in my 30 plus years of practice. I mean, I never thought we'd get to a state where, you have to go through a metal detector to go into the hospital, and
Yeah.
you have to show, some sort of identification. So it is interesting. I think we are behind Minnesota because we've never dealt with this kind of thing, like the
Yeah.
George Floyd um, riots and everything that happened back then. I think impacted them in terms of preparedness and for what they do in a situation like this.
Yeah, absolutely. Well, thank you for sharing that. This is sort of the dual perspective that you bring
Yeah,
to the audience is incredibly valuable. Dr. Somani, because we have not chatted with someone in Ohio in a while,
yeah,
I did want to bring up but today we're mostly talking about ICE, but we do have listeners who are deeply interested in the outcomes of the Medicaid fights and the ACA rollbacks.
uh,
We
yeah,
know that state legislators across the country are handling the Medicaid cuts really differently. Like the range
mm,
of the way states are approaching these
yeah.
budget cuts is big. I'm wondering if you could share for our listeners what's going on in Ohio, if you have an update on the
Yeah.
fallout from the One Big Beautiful Bill.
Well, with the one we did, Ohio is one of the few red states when Kasich was governor that actually did approve Medicaid expansion. So
Yes.
we do have that.
Yep.
And as a result of that, the first thing that was going to get cut was if the federal expansion was cut, then we would end up taking about 770,000 people off of our Medicaid um, you know, eligibility. And that includes seniors, veterans, kids. It's just tragic. Um, I, I think we're still in limbo because I don't know. I mean, I know the extensions expired at the end of the year, but then there was some question of bringing them back and would we extend them? And So I can't tell you for sure how many people have been taken off, but that's a huge amount. That's a significant percentage. And I know as an obstetrician, half of our deliveries here in the state are covered by Medicaid. So it will truly impact our families. And for an administration that claims to be pro-family, these cuts in Medicaid are certainly not pro-family. The other thing that the state legislator, and I'm on the Medicaid committee, there
Yep.
have been some legislation to defund Planned Parenthood so that patients could not access any type of reproductive care through Planned Parenthood if that place provided abortions, which the majority of them don't. 96% of the
Right.
care they provide is reproductive care.
Of course.
So that's one big place that they're trying to limit Medicaid expenses. And then the other way they're trying to limit the amount of people who qualify is reinstating work restrictions or work requirements. So you'd have to prove that you're looking for a job or that you are working. But my experience with patients on Medicaid is they are working 2 and 3 jobs, but they are working at places like, Amazon or warehouses where either they can't get coverage because they don't have enough hours, or the cost of health insurance is so high that it's cheaper for them to insure their kids through Medicaid and just go without insurance themselves.
Yep.
So I don't think the solutions are the answers. I think that we're creating bigger problems that will lead to just a less healthy America. This idea of make America healthy again is not working the way they're running the
Yeah.
Medicaid part.
Yeah, that's for sure. All right, Dr.
Yeah.
Somani, I know you fit in us and our listeners in while you are in the act of practicing medicine. So
Exactly.
I just wanted to say thank you so much for taking a minute out of your day today.
Yeah, well, it's always great when you have X amount of time between surgeries,
Yeah, right.
like literally they were just like, when we were talking, they were like, oh, patient's in the room. And I'm like, okay, I have 15 minutes to get back there.
Great.
Because anesthesia has to put the patient to sleep. They have to prep her, and I get to be the last person to show up. But thanks for accommodating my schedule.
Yeah, no, thank you so much. We'll talk to you soon.
Okay, bye.
All right. Thanks again to Dr. Chris Ford of Milwaukee and Dr. Anita Somani of Columbus, Ohio. It's great to hear perspectives from around the Midwest. And this is one of the things that I think we're going to continue to do here at Paging America is we have friends in a lot of places, physicians who are trying to do their job across the country. And we're going to try to bring in perspectives from different cities, as it doesn't seem like I'm so reluctant to call it immigration enforcement because it doesn't seem like that is the main goal at this point. They are immigration agents, but and yes, they are doing immigration enforcement, but they're up to something else too. And so I'm reluctant to give them the benefit of the doubt in any way at this point. But thank you to our guests for offering their perspective.
Absolutely.
Dr. Rob, the ACIP, more weirdness out of Bobby Kennedy's HHS. That's what we're going to cover next. So we're switching gears a little bit, everybody. The ACIP chair is now questioning the need for polio vaccines. The new chair of the CDC's Advisory Committee on Immunization Practices, more commonly known as ACIP, Kirk Milhoan, does not believe that public health is the first order concern of the group and questions the need for the polio vaccine. I'm going to give you a quote. As you look at polio, we need to not be afraid to consider that we are in a different time now than we were, he said. It's been very important to us, members of this committee, that what we are doing is returning individual autonomy to the first order, not public health, but individual autonomy to the first order. When asked where the line was for him when it came to individual autonomy infringing on the safety of others, Millen said, let's just flip that the other way around. What if the child gets a measles vaccine to protect your immunocompromised child and gets a negative consequence from that? Wasn't that your child causing that child to be harmed? Question mark. It seems to me, Rob, that the people that are in charge of the CDC think that the downside risk of vaccines is greater than polio and measles. What are your thoughts?
So a couple problems with the assertions made, right? One, we're in a different place than we were previously. Yeah, no shit, right? Because of vaccines, right? We don't have polio now because of the polio vaccines. So, okay, if we have less people getting that vaccine, guess what's going to come roaring back? I guess the second real, kind of big picture concern about his assertion is that, well, the CDC, the job is not, public health. Well, no, the actual name of the CDC is the Center for Disease Control and Prevention. That is their actual job, right? When people go to their pediatrician or their family doc and have conversations about whether or not to get their child vaccinated, that is the individual concern part of medicine, right? I'm as an ER doc, that's what I do. I have conversations with people about what to do about them having chest pain, right? We also want to practice good public health and get people tetanus shots and encourage people to get flu shots and to stay away from other people, not get them sick. But largely our job is like that person in front of you. This guy, he works for the CDC. He needs to just take a look at the nameplate, take a look at his business card if they still have those. So yeah, obviously a problem. I don't know. You're in the throes of getting a kiddo vaccinated and making those choices and talking with doctors about that. What do you think?
Yeah, I mean, I think I've said this on this show before, is that the pediatrician we see, basically they've stopped looking at the CDC's recommendations and are just totally looking towards the pediatrician's professional organization for the vaccine schedule, because people don't believe the information that's coming out of here or coming out of the CDC. I also think this is like an exceedingly predictable outcome of populating HHS with a bunch of kooks and crackpots, is that you're going to have people going down weird rabbit holes and sleuthing on the internet and finding, and I don't know enough about this guy to understand. We're going to figure it out to understand if the new head of ACIP is a true believer crackpot or he's in the service of Bobby Kennedy doing coalition management. Is he making money? Is he managing the political coalition, or is he a true believer crazy person? And all three of those, I'm not sure it matters, because all three of those are like equally bad for the children of the United States of America and equally bad for the disease control. It's one of them.
I mean, in the same vein, does he think we should not be having like water treatment, right? Should we go back to just having raw sewage running through the streets? We want to go back to cholera, right? In the time of Jon Snow in London and the water pump. Those of you who are epidemiologists on here will know that story. Like that. That's what he's talking about. Like, get rid of all this shit that got us to this point, because we got to this point. We don't need any more. Why not get rid of seatbelts? People don't die as much from car crashes. I mean, Jesus, it doesn't make sense.
Yeah. I've tried to extend the metaphor for cholera. Who would be harmed? It would be the person who had to build the well, maybe? I'm not sure. Anyway, we can move on. All right. We have news. The U.S. is no longer part of the World Health Organization. This is personally sad for me, Rob, because I don't know, my internship in college was at the Pan American Health Organization, which is a subsidiary of the World Health Organization. So last Thursday, the U.S. officially withdrew from the World Health Organization, a process begun by Trump the previous year as one of his first acts after being sworn in. Politico reports that whether or not the U.S. rejoins WHO largely depends on if the next leader makes Trump happy. After 77 years, the U.S. is no longer a member. Now the race is on to convince President Trump that he should rejoin. The key to a potential return is who becomes the leader of the WHO next year and whether Trump likes him. So it's all back to the cult of personality, not about whether we're making people happy or happy and healthy and less sick, and we're providing sort of health security around the world. The United States led the World Health Organization. Let's be clear. This was not us doing charity. This was us marshaling resources around the world to control for population health and disease and control disease the world over, because diseases don't know borders, right? and
particularly
so that's
now, right? More and more, right? With international travel, like us having an ocean between us and all the nearest countries, to our east and to our west, probably was a lot more. Yeah, definitely was a lot more of a barrier back in the day, right? But like now, like absolutely, these things, as we saw with COVID, right? All too clearly. Crazy.
The Trump administration wants the global health body to be led by an American director general and inspector general, according to Larry Gostein, a global health law professor who directs Georgetown University's O'Neill Institute. The reality is that America always led the WHO, and that's why this is so stupid. It didn't matter if it was someone from another country. That person was probably a competent person, and it would get buy-in from other countries to participate, because it can't look like just like America using health integration systems to dominate their perceived opponents or adversaries. It's such a like dumb 14-year-old boy, like on the playground way to look at world health. It's so frustrating. So the increasing threats from new viruses and diseases like the Nipah virus in India makes the withdrawal from the WHO more perilous. Nipah virus can spread from animals to humans and has a high fatality rate. One other intersection with my time at the World Health Organization and what's happening in the news now. One of the really neat things that PAHO used to do is they used to coordinate with Southcom, which is the U.S. military in Latin America and in South America, and instead of using fishing boats that may or may not have cocaine on them as target practice, they would work with the U.S. Air Force to, as they were doing training or as they were going out and practicing in airplanes, they would bomb dengue fever mosquitoes with fumigation materials, and it was really cool. It was like it was the public health infrastructure basically like saying like, hey, if you're going to be out there anyway, could you kill all these mosquitoes and save all these thousands of lives? And they were like, sure, and now it's just all fucked.
Yeah, I mean, we were effectively out of the WHO, right?
For sure.
But at this point, right, officially, because we hadn't paid our dues in a year, that went away. And it's a really sad marker in time. It is something we can get back into, obviously, right, with the change of administration. But there's a long way away. Like a lot of things can happen between now and then.
A ton of bad shit can happen in 3 years, like the first year of COVID was terrible. And so, all right. All right. So enough of the terrible news around the world. Let's have a little bit of fun, for the rest of the show. So I have a question, Rob. What would it take for America to forgive Senator Bill Cassidy? After casting the deciding vote on the confirmation of Robert Kennedy Jr. to lead HHS, Louisiana Senator Bill Cassidy, a physician, has had a lot to answer for when it comes to healthcare. In fact, nobody seems to like him, even Trump, who just endorsed Louisiana Congresswoman Julia Letlow, who's running in a primary challenge against the incumbent. So Bill Cassidy takes his soul, puts it in a little box, sells it to the devil on the cheap in the hopes that he doesn't catch a primary challenge. And then just totally undermines all of his credibility, both as a senator and as a physician. And what happens? Kind of out of nowhere, in what looked like he might not have even planned it, like he might have just done it on the fly, like she looked a little surprised, Donald Trump comes out and endorses her for a primary challenge against Senator Cassidy. I don't know. I can't. As the Republicans eat their own and punish their allies, one of the things you can do is you can like find a little bit of joy in like their internal tumult.
Watching Bill Cassidy be uncomfortable. I mean, he committed the ultimate sin, right? He voted to convict Trump in the impeachment trial. He was one of the however many there were. And so it seems like he's been trying to atone for that ultimate sin ever since then, right? In the eyes of Trump. And maybe he thought, well, enough time goes by, enough daylight between that vote and everything else I've done to bend over backwards and twist myself in a pretzel to support this guy. And sure enough, of course not. I mean, I think Trump's kind of memory of retribution goes very far back. Like, I don't think this guy forgets anyone who ever crossed him in his life. And he's determined to like fuck him up however he can do it. And in this case, this is how he does it. Good for, I don't know, like, hey, I'd like to see Bill Cassidy squirm. That's great.
Yeah.
And what will it take to forgive him? I don't know. I have no answer for that.
Can
Do you have an answer?
I run a couple Can I run
Yeah.
a couple things back and see if you forgive him, or if you think America should forgive him for this? So, okay. So he voted for Bobby Kennedy.
Yeah.
So RFK Jr.'s hand-picked advisory committee on immunization practices, he said that the head of ACIP, the guy we were just talking about, does not protect children. Do we forgive him?
No.
Okay.
Is this a strongly worded tweet?
Yeah, it was just a statement.
Yeah.
He didn't do anything. He's just a statement.
Yeah, didn't do anything about it.
So,
right. No.
okay.
Yeah. No.
Okay, so he accused ACIP of a lack of scientific process being followed, did not change his vote, took no action, but he did accuse them in public. Do we forgive him?
No.
Okay. All right. He urged the director of the CDC to reject ACIP's recommendation to no longer administer doses of the hepatitis B vaccine to all newborns. That is still their recommendation. Do we forgive Bill Cassidy?
No, isn't urging just the action word of concerned? I mean, now they seem to be cousins. Yeah.
Yep. All right. And then he called for a full joint federal and state investigation into the fatal shooting of Alex Pretti in a statement, and he called his death incredibly disturbing. We agree with that.
Agree.
To date, we do not think there is a full investigation, or if there is, there's opacity around it. And I'm not sure I forgive him for that. I'm not sure that that atones for much, particularly on the public health front.
Yeah, for sure. For sure. And before all this, I remember back a long ways back when he and Jimmy Kimmel had a bit of a public feud about the ACA, when he was like a leading voice in repealing the ACA back in Trump version 1.0. Yeah. And, as a physician senator, like, fucking, how dare him? How dare he try to take healthcare away from 20 million people? Yeah. And so, this guy's been at it for a while. He's got a hell of a long way to go to get anyone to forgive him.
All right, Senator Bill Cassidy, you are not forgiven. Enjoy your hours of futile call time trying to save your own ass in the Senate. Have fun, bud. All right, we'll revisit though when Bill Cassidy does some more. We'll come back here and we'll decide if Senator Bill Cassidy is forgiven yet for his vote for Robert Kennedy Jr. All right, Trump's health is back in the news. From the New York Magazine non-paywall version, here's a partial list of some things. I'm not going to read the whole list. It's a huge list. So, bruised left hand at Davos, ankles swelled up in August. He had a droopy face at the 9/11 memorial event. He couldn't recall which part of his body had been imaged during the October MRI. He was seen limping at his New Year's Eve party. He demanded control of Greenland because he hadn't been awarded the Nobel Peace Prize, which isn't necessarily a health thing, but maybe it's his brain going bad or going worse. And then he couldn't remember the word Alzheimer's when talking to a reporter about his father's battle with the disease, which seems like a little relevant. Meanwhile, staff are consistently running interference, and we've had like all these reports of both foreign politicians as well as domestic politicians saying that his brain seems like mush when they meet with him. What do we do, Rob? What do we do? I think we just have to, or if it's like whatever it is, like what do we do if we got to keep talking about it? Okay,
we do. I mean, I think that there's so much going on. I mean, I get it for reporters, and so I feel like it's a trickle of information on this front, right? But it feels like if he is like really cognitively challenged, like that has a lot to do, or can have a lot to do with all the other things that are going on, right? I mean, you tell me Stephen Miller isn't just sitting there in the background, kind of rubbing his hands together, thinking, "Oh, yeah, this is my perfect." He didn't have to get elected. He can just
look at
what the prime minister? They call him the prime minister, isn't that the reporting? Stephen Miller,
the prime minister.
Yeah, so
it's all very European in the Trump court. There's lots of European phrases from old world politics being circulated.
And I can't stop thinking about his comments about aspirin. Like, it's so crazy to me that he will just go on and on about taking the big aspirin. And they tell me I don't need to take the big aspirin because it'll make me bruise. But if you whack your hand and you can handle the bruise, makes my blood thin, and I don't want thick blood going through my heart. It's like, fuck, like
Something's wrong. Something's like, isn't it like possible that he has like some major condition that he himself doesn't totally understand because he is, a gifted politician, but a bit of an
and
idiot.
He's surrounded by people, who call him a deity, right? Robert F. Kennedy Jr. called him a deity, right? I think. Oh, yeah, go ahead. Yeah, you got more, I think.
Marco Rubio said, quote, "The guy is too healthy," end quote.
Too healthy.
All right, Marco, cool.
Maybe it's from too much aspirin.
Too healthy.
Wow. Yeah. Okay. Yeah, like he's got all these fluffers around him, like telling him how fucking great he is and how healthy he is and what an amazing specimen he is. How could he possibly know something's actually wrong with him, right? The emperor has no clothes, but unfortunately, at the end of that book, this emperor didn't figure it out yet. So, this is something we should be concerned about, Miles.
Totally. His brain seems mushy enough that maybe it will end up as a specimen, hey?
Jeez.
Oof.
God.
Anyway,
we're getting out of the dark stuff.
So, I don't know. I thought everything is like pretty... yeah. Well, here we try not to do... I mean, I wouldn't because I'm not a doctor, but we try in our work, we try not to diagnose a person, like do a clinical diagnosis through the airwaves. But the laundry list of deterioration is like just wild.
And I won't give medical advice, except I will tell you, do not take a full-size aspirin unless your doctor tells you to. There are a few conditions out there where full-strength aspirin is the thing you do. There are not very common. And 81 milligram aspirin, or probably even less than that, is adequate and appropriate and avoids the chance that you bruise when you whack your hand, or worse, you start bleeding out from some orifice. So I guess, I will happily do that as medical advice, and people can take it.
Rob, can I try my hand at offering some medical advice as a political scientist? Yeah. If you get like very bruised when someone just passes by you and you have like blood on the inside of your hands because of like handshakes, you should not go have like a vigorous handshake with Nicki Minaj and her very big fingernails, which she did the other day. The people were making jokes on the internet about it popping his hand. They were zooming in on the handshake. It was very, very funny. So that's my medical advice. If you have extremely fragile hands, don't shake hands with rapper Nicki Minaj.
Good.
Yeah. All right. Great. All right. So we have news from our weirdest billionaire, Elon Musk, he says going to medical school is pointless now thanks to his robots. Not just like AI. Like he's not like he's like making a point about AI, but he's making a point about AI plus his robots. And so on the Moonshots with Peter Diamandis podcast, Elon Musk told Diamandis, the executive chairman of the X Prize Foundation, that in 3 years from now, going to medical school will be pointless because of his Optimus robots will be better than the best human surgeons, and there will be no more of them than there are all of the there will be more of them. There will be more of the Optimus robots than there are all surgeons on Earth. So he said in 3 years, it'll be obsolete to study medicine because of the combination of AI and his weird robots. And I think we put together a little bit of a video roll of some of Elon Musk's greatest creations as maybe a window into the future, our medical future, and how exciting it'll be to have healthcare administered by Elon's robots. Chris, could you play that video?
Oh God, I don't want that happening when you're taking my gallbladder.
Oh, that's his driving cars. Yep. Oh, that's a car crash. Yep. And that's just a Cybertruck stuck in a little bit of snow.
Yeah. So anyone who didn't see the video, if you're just listening, right? A little greatest hits of SpaceX and of Tesla vehicles gone awry.
Yeah.
Wow.
I don't want Elon Musk's robots anywhere near my body. Elon Musk's robots don't fucking touch me.
Right. Yeah, like so robotics, right, are involved in surgical procedures now at this day with a physician, a trained surgeon in the room doing that. I don't want Elon anywhere near that. To me is a particular concern of this. If there was some other benevolent billionaire out there telling us about their wonderful robots and the great things they could do, I would still be concerned. But like, okay, maybe there's something in that front. But like this guy telling us in 3 years to scale, like the SpaceX explosion on the runway could happen during your appendectomy. Like that seems like a real problem. I don't want that thing operating on my belly.
Totally.
Yeah, like I don't know. Like, one, telling you no one go to med school. Like, I would hate to see a robot telling someone they had cancer, right? Telling someone, I'm sorry, your loved one isn't going to make it. Like, Jesus, like, but this guy doesn't, he has no empathy. He has no concern for any of that. So that wouldn't even come into play. But then, the obvious issues with like just autonomous robots just sitting there cutting on people. Like there is so much nuance and so much gray area when it comes to medicine in general and surgery in particular. If you ask any surgeon, that's something when I go into ChatGPT, ask a simple question and it gets it all fucked up, for the first 3 tries, I think, okay, I don't want that to be my surgeon.
Yeah. I think that Elon Musk is juicing his stock price again, not actually talking about the future of healthcare. So I don't think we should get too fired up about it. But I also think, I don't want.
I think he thinks though that this is the next 3 years, and I'm worried that the people in charge of this government might be led to think that as well, right?
That's right. They've incorporated Grok into the Department of Defense, and that is probably premature because obviously Grok is like both getting things wrong, calling itself Mecha Hitler, and also committing sex crimes on the internet. Like that a particular AI is one of the more egregious examples of technology gone awry. So I'm not sure we're ready to put it in charge of heart surgery anytime soon. The other data point that I think is really important when Elon Musk makes very silly claims like this is he has his autonomous vehicles that crash and have problems, and Waymo has autonomous vehicles. And Waymo, when they test it, they do this test where they put a stroller in front of the car in various ways, and the Waymo always dodges the stroller, even if it destroys the Waymo. Like the Waymo will hurt itself before it'll run over an infant. Elon Musk cars hit that infant all the time, like the fake infant. The Elon Musk cars like run over the baby like pretty frequently in the tests, and so like I don't think his products should be incorporated into the Department of Defense or healthcare anytime soon.
Is that something about the personality of the creator being embodied in the creation?
Yeah,
I mean, I don't know. I don't know. I don't know much about Elon and his connection to his children, but there's reporting. And I've read the reporting, and I'll leave it at that.
Yeah. All right, Rob. Let's do one more thing. We had you had seen a skit from Noah Wiley on Jimmy Kimmel. I wonder if maybe you could tee it up.
Yeah, I mean, Noah Wiley, who's famously now plays Dr. Rabinovich on the Pit, and Dr. John Carter on ER back in my day, going way back when I was back in college and med school and cutting my teeth on TB hospital shows, and Jimmy had him on to kind of. I guess to poke fun at the ridiculousness that is going on at HHS and RFK Jr. and sort of non-physician, non-scientist practicing public health, practicing healthcare. And, you have to just laugh at some of the shit once in a while, right? You have to laugh at the ridiculousness of it. So I think do we have a little supercut of some of that?
Some of that as a palate cleanser.
Yeah.
But that doesn't matter, because when it comes to medicine, I do my own research and I go with my gut. For instance, I know that raw milk is good for you, but raw chicken, even better, especially when it comes in a smoothie. The flu vaccine will take 4 inches off your penis or vagina, and if you take probiotics and antibiotics at the same time, you will achieve the perfect level of biotics.
That's pretty good.
Yes? Hello? This is he? Yes, I would be honored to head up the Center for Disease Control. No, thank you, Mr. President. Well, it looks like I'm a medical expert after all.
That's
God,
good.
that was so good. The
Yeah,
biotics one is I don't know.
Yeah,
That just
yeah.
particularly because I get questions on are probiotic. Like I think they're probably fine, but just like getting biotic levels, like that's fucking
Yeah.
Yeah, I
that's
appreciate it, and I also think it helps all of us in advocacy because when they
Yeah.
poke the bear like this and poke fun, and a different group of people see it, maybe then might be watching or listening to what we're doing, right? Or watching or listening to briefings by RFK Jr. or Trump, a different group of people, and they're looking at this thing like, well, this is really funny, but wait, what the fuck is he talking about? And they go start looking into it and say, holy shit, these guys are crazy. So I think it is as a piece of the puzzle, and Noah Wiley, open invitation to come and chat with us anytime about your medical expertise.
Noah Wiley, come on the podcast.
Love to have you.
We want you on the podcast.
Absolutely.
All right, great.
So if Noah's listening or
right,
anyone associated with him listening, give us a call.
Yeah, give us a call. All right, I'm going to read us out, Rob.
Yeah.
Today's episode is written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. It was produced by Amelia Dillenschneider, Joel Bryson, and Chris Savage. It was edited by Darian Badigan. Our music is by Annette Somerset at Duneflower Productions. And if you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, or Apple Podcasts, wherever you listen. If you want to support the show, you can become a paid subscriber on our Substack. We'd really appreciate that if you got a couple bucks to spare. And then physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committeetoprotect.org to learn more. Dr. Davidson, bleak at the front, funny at the end, but a good show. Thank you so much for this conversation. So
From Kiwi Land, cheers.
yeah, bye everyone.